You were mentioning what keeps you up at night and some of the huge gaps in child and maternal health. Can you go through those and what do you most worry about in those gaps and why have we not been able to decrease those gaps?
Yeah, so there are certainly a lot of gaps in maternal and child health. For example, an African American woman still 3 times as likely to die from pregnancy and childbirth as a white woman. An African American baby still twice as likely to die within the first year of life as a white baby. And that's just racial, ethnic. There are also socioeconomic, there are geographic gaps. I think some of this driven by differential access to and quality of healthcare. It's really not just healthcare. It's also all the social determinants, housing, poverty, education, father absence, and even racism operating across the life course are the real drivers of these gaps in maternal and child health.
You talked about the role of the federal government and what you didn't say it's at all was top down. It's really bottom up. Can you talk about what you've learned from, how the community, how that bottom up process works best with the federal government?
That's right. So one of the aha for me in the last 4 years is that the real work of improving maternal and child health in this country really happens on the ground at the community level, at the state level. And we as their federal partners, that the best thing that we can do is really to create the conditions to help them succeed. And so I do think that requires that kind of partnership, federal, state, local, public, private, if we really want to move the needle in maternal and child health.
What are some of as you travel around the country, you look at state programs, you look at local programs, where are some of the things that really stand out to you? Is moving the dime is really making a difference in maternal and children health.
Certainly, I want to give a shout out to California, which has really been the pioneers of some of the improvements and innovations in maternal and child health. I think California, both CMQCC, CPQCC, March of Dimes, as well as public health programs that have really kind of pioneered some of the safety bundles to reduce maternal mortality and severe morbidity. They pioneered one of the first toolkits around reducing early elective delivery, and the rest of the nation is taking notice that they're really trying to replicate the successes of California.
What does it take to do that in a state like California that had really enormous problems in child mortality, as you said? What does it take? It takes a political will. What else does it take?
Well, I think it also takes incredible leadership and partnership. So, for example, what I saw in California, around maternal mortality effort, and as you know, up until 2006, California's maternal mortality really was trending with the rest of the nation. The numbers just kept going up, but it took a few champions to get it started, and they started kind of mobilizing this network of doctors, nurses, public health professionals. They went around the state. They engage hospital in quality improvement initiatives. They do labor in service to labor and delivery staff, and you can see that the needles start to move. So, as I mentioned, California was trending with the United States up until 2006, and then the curve started to bend. And in 6 years, California's maternal mortality ratio was reduced by about 64%. And African American maternal mortality ratio was reduced about 50%. And so again, you see the power of collaboration and partnership, but it's also speak to the importance of leadership.
You mentioned also regionally in the South that the South has had over decades really pretty significant problems in children's health and maternal health, and infant mortality rates in the South have been pretty high in the past number of decades. What do you see? What's happened that really has been great success also in the South?
That's right. So with our collaborative improvement innovation network that really started in the South, we were able to bring different partners to the table. And it's not just the Title V maternal and child health directors, but also the state health officials, the Medicaid directors, the representative from governor's office and state legislature, as well as professional and community leaders, all trying to work together to move the needle on infant mortality. We create this collaborative improvement and innovation platform for them to be learning from each other, to share best practices. The 13 states, southern states, shouldn't have to reinvent the wheel 13 times. And so over the last few years, you can really see how they're really kind of learning from each other, how they're improving and innovating together. And so over the last few years, there's been about 30% reduction in early elective delivery, translating to about 85,000 early elective deliveries averted. There was also about 12% reduction in smoking during pregnancy, translating to about 18,000 fewer pregnant women smoking across the South. Certainly, we can't take all the credit for that, but what I think this network has done has really accelerated that collaborative improvement and innovation across the South. And so I think that's what I meant by, if we can create the conditions for states and communities to succeed, but give them the ownership, and I think there's just tremendous amount of ingenuity, creativity, and leadership at the local level, at the state level, that they can really drive the improvements that we want to see in this country.
And you came out of university, a great university, UCLA. And you're here at a great university, Stanford. What's the specific role in this of the partnerships, the collaboration of the academic medical institution?
Yeah, I certainly think academic institutions can play a very important role. Certainly, first and foremost, in terms of creating that knowledge base, and I think this really reflects a fundamental belief for this administration that it really should be science rather than politics and ideology that should be driving what we do in maternal child health. And so I think university has always been on the forefront of that knowledge creation, of driving innovations. And so that partnership with academia, with universities, has been really critically important in terms of providing new insights, suggesting new approaches to improving maternal child health in this country.
One of the seminal achievements, certainly, of the Obama administration has been the Affordable Care Act. And what has been the impact for women and children, its broad impact upon increasing health for women and children?
Well, I think, first of all, it's just increasing access to health coverage for millions and millions of women and children, and also increase protection. So the ban against exclusion based on pre-existing conditions, and I also think that the focus on preventive services has been critically important, and now as we shift from coverage to delivery system reform, we're also looking at how do we improve our system in order to drive improvements in maternal child health in this country.
Great. Anything else?
Well, that's it.
Okay.
Thank you.